I wish my video was working.
You have to show me how to do the YouTube, because I don't know how to do that.
Yeah. You just make an account and then
You want to switch spots?
All right, ladies, let's bring it back.
You want to hold it?
All right,
Yes,
I will be loud
Let's do
enough that you guys can all hear me.
do it.
Get right in your face. Don't worry, I'll focus on that.
All right, please. All right, so reproductive organs, the male, that would be penis and the testes. You guys have, pretty much gone through this at least once or twice. There's a lot of really important parts. We are going to dissect testes today. Okay, so I'm going to leave some of that for us to go over, but remember the main parts. What is the sac that surrounds the testes?
Scrotum.
The scrotum. What is it for?
Because if the testes are up in the body, it would kill the sperm.
Okay.
Does that have to be like cooler
That-
than the rest of your body?
It is cooler than the rest of the body, but in general, the scrotum itself acts to cool the testes. It itself is a cooling mechanism. So your testes are generally 3 degrees cooler than the rest of your body. That is because of the action of the scrotum. So it has a distinct purpose. You guys have also heard, hopefully, about the vas deferens. Okay, also spermatic cord, and the spermatic cord houses the vas deferens. Okay, and you also have that's holding the testes a muscle. You guys ever heard of that muscle? Okay, it's called the cremaster. Cremaster.
C-R-E.
Am I saying it properly? I think it is cremaster. That C-R-E.
Like it sounds.
M-A-S-T-E-R. No, C-R-E. Cremaster. Okay.
I love your analogies.
I am not loving it. Okay.
He's being videotaped, people.
Okay. You guys know that is the muscle that retracts the testes. Okay? And there's a couple of different reasons why the testes would retract. First off, it's cold. You just wave at them until they disappear. Gone. Okay? Also, during ejaculation or when you have sperm being ejected, that pulling up of the testes actually it gives sperm more force. Okay, so it moves quicker. You guys have never heard of that? That is what allows more ejaculation. Okay, so that is moving of the testes themselves.
What if they're permanently retracted?
Permanently retracted is problematic. Okay.
My son has that right now.
Okay.
They won't come down.
This is one of those things that they're really worried about because they worry that the spermatic cord is going to pretty much get cut off, or you're going to cut off circulation to the testes themselves, and that would be essentially neutering.
Oh.
Okay.
Is that the only
You guys
thing that
know
could
what
come
castration is, right? Castration is cutting off blood supply to the testes, and after a certain time, they will just fall off. I used to live on a farm. I know how this used to happen, and they could do it with rubber bands, and that's all it would take. Okay? What?
So any other serious things that could happen besides...
That's serious.
I know it's serious. I know it is, but...
Well...
And they could, yeah.
The other thing that they're really worried about is when that cremaster muscle causes it to retract. Sometimes it causes it to twist too. It's just really dangerous when that happens really early and they can't get the retraction to stop.
Can they just push it down?
Oh.
Well, they try. Well, I'm worried because they're telling me that they're probably going to wait until he hits puberty. Maybe they'll drop. And I'm like, well, that's going to be a while. He's only 7. So I'm afraid of damage during that point. You know what I mean? So I'm thinking maybe change doctors.
Well, sure. I'm going to say go with your doctor. I don't have any idea about what's going to happen between age 7 to 10, but by 10 they ought to start like
They said surgery and all kinds of stuff.
loosening. Wow. Okay, it's a little early for surgery, but I'm not sure. Never hesitate to get a second opinion, but specialist are who you go to for something like that. You don't want to go to just a general practitioner because it's not something that they see.
Yeah, no, it's a specialist.
Okay. All right. You guys with me so far? Now, that was just sperm is produced in the testes, and I'm going to show you guys how that works. We're going to go in over a lecture about the actual assembly of sperm itself, but you have all your seminal vesicles within the testis itself. When we do dissection, you're going to see that. It's going to be a little more interesting. You'll see the epididymis, the head and the tail of the epididymis. This is the collecting vesicles and where you pretty much where sperm travel from the testes to the spermatic cord. Okay? Pretty much through the vas deferens. We'll get through all of that. You guys with me? All right. Also, you guys know the spermatic cord comes up, okay, and then meets with your urethra, okay? Where does the vas deferens meet with the urethra? Any ideas? Have a look at your lab manual. Where does the spermatic or your vas deferens meet with the urethra? Because they both go through or both sperm and urine travel through the urethra, right? How about the prostate? Yeah. So the prostate is where, yeah. And what you've got right past the point where you get to your prostate, as things pass through the prostate, you have the bulbourethral glands. You guys ever heard of those? They actually secrete, fluid. It's antimicrobial, and it helps semen travel through the urethra. Okay, so all this is due to ejaculation, but it's very important to get sperm to actually travel through the urethra. Otherwise, it's not going to have enough force to get to where it needs to go. Okay. In general, you're going through the urethra, you have to pass through the penis itself, okay, or the glans penis. Now, you guys have to think about the urethra as a main part of this, but when you dissect it or take it apart, it is just the inferior part. You have just a small pathway through the penis itself, or the glans penis. This would be called the spongy urethra. Okay, you guys with me? Okay. Now, on either side, you have what's called the corpus cavernosum. You guys can probably see that in your lab manual. This is the part that gets engorged with fluid or fills up with blood during an erection. This is extremely important because, especially nowadays when we hear so much about issues with erectile dysfunction, this is where that doesn't happen anymore. Okay? And I used to really enjoy medicinal chemistry because when I was taking medicinal chemistry and you looked at the parts that you were getting to, this corpus cavernosum that fills up with blood to cause an erection, this is when they were coming out with Viagra. You guys ever heard the story of Viagra?
Yeah, you told us.
You told us. You told us in biology.
Yeah.
It was not for hair.
What was it again?
Okay, that was the other
That was the other one.
blood pressure medication. You guys have not heard of this? So, I was in medicinal chemistry, and we were learning about the way that the FDA works and how you get through medicinal trials, okay? So they were creating blood pressure medication.
That's what
right?
it was, blood pressure.
So you're going through and trying to figure out blood pressure medications. And, you have your beta blockers and you affect nitric oxide, right? Well, they had a drug that's affecting nitric oxide levels. And it turned out that this drug did absolutely nothing for blood pressure. Okay? However, every single patient that got through clinical trials and they were trying, they said, man, I have like a ridiculous erection whenever I take this medication. Okay? And Pfizer, being the brilliant people that they are, said, We can market that. Okay? So this, I got to tell you, 9 times out of 10, same thing with Rogaine. It is side effects for a drug that they're trying to find out. The drug itself worked crappy. Okay, minoxidil, or what Rogaine is, it did not work for a blood pressure medication, but it is a side effect that it caused hair to grow. Okay, Viagra was meant to be a great blood pressure reducing drug. It was crap, but it caused erections. Okay, and it allowed people that had erectile dysfunction or could not get an erection. Now they can, because they take this magic pill. It has been abused for the last 8 years or so. However, the thing is, what I want you to get is that drugs are generally found by accident. Most real medical discoveries are found by accident. You are not going to find what you plan on finding. Okay? Okay, so you guys with me on that? You definitely need to know the different parts of the male reproductive organs. But we're going to do a dissection on that, so I'm not going to spend an enormous time with it. However, reproductive organs for females a little different because we don't have a model, and for that would be fairly difficult, right? So, I want to go over some of the main parts of the female reproductive organs.
It's hurting.
We'll get to, some of these are fairly interesting, okay, for the most part.
Twins.
What? Twins? I don't want to see twins.
I don't either, ever.
Who's representing twins? What, you've got twins?
Yeah, 2 boys.
Oh.
Nice.
That's awesome. Natural or C-section? Okay. Woohoo! I'm representing C-section right here. 2 thumbs up. Natural childbirth?
I had natural.
Huh?
I had natural, but 1.
Hey,
What's better?
if you are good for it, go.
Natural.
I'm still.
But
What keeps you sane?
What keeps you sane? I'm just gonna go with my blood pressure was
Either.
screwed up
For weeks, right?
for months.
Yeah, months.
As a matter of fact, I only got off of my blood pressure medication 3 weeks ago.
Ooh.
wow.
So how long ago did I have
That
my
was
daughter?
forever
6
ago.
months? Yeah, so 5 months of screwed up blood pressure, and I didn't even have a kid. It was my wife. So that was natural
You're feeling her
childbirth.
pain. That's what it
Huh?
was.
Whatever.
I don't know.
I'm just saying, if you are able to do natural childbirth, then you are awesome. You are like Superwoman, and I will give you credit. You did?
Woo!
At home?
Wow.
Oh my god.
I have nothing but respect for you. But I'm going to tell you right now, that right there scares me.
That scared me.
10-pound boy at home.
10-pound?
2 hours.
Mine was 9.
Wow.
Ah,
I was 6.
And my son was 9. Labor 27 hours, pushing for 3. It was hell.
Our baby's like
Do you
bigger
see?
now. Like our baby's bigger now. It's like, I don't know. I was, me and my sister. Well, my sister was like 7 pounds and I was like 6. But I feel like everybody's babies now are like 9 or 10.
Yeah.
I don't know. All right, so, ladies. I could try to bring it back, but I'm going to tell you, it was not a wonderful experience. I still have nightmares. My wife was telling me when I had another kid, and I was like, why?
Why?
Aww. But look at your bundle of joy you have now.
Oh, I love my daughter. I would not trade her for anything, but that was still not the best experience of my life. As a matter of fact, it was more grueling than graduate school.
No, but that's where you develop lactose intolerance.
And an ulcer.
Yeah.
So, there you go.
It's videotaped. Everything you say.
I know. My wife knows this. Whenever she asks, she's like, what do you think about having another kid? And I was like, I don't want to go through that again. She said, had a C-section. She said the next one will be like, we will make an appointment.
Yeah,
We will show
pretty
up
much.
for it. She said it's not going to be like that again. So she's all right. As long as I don't have to do that again, we're good. Yeah. But that's horrible. Okay. So we're going to get into female reproductive organs. I'm going to start with the internal ones and we'll work out. So, 2 ovaries, okay? Not too big a deal. You get to your fallopian tubes attaching to your ovaries, right? Okay? Eggs are produced in the ovaries. I used to have some really good slides for this, but I don't have any of them out today, which is a little frustrating. We might look at slides next week, right before we do our review, because they have really decent release of the eggs from the ovaries into your fallopian tubes. Okay. Now going from the fallopian tubes to the ovaries, they have little finger-like projections. You guys know what they're called? They're fimbriae, absolutely. So you guys know most of this. It's not like it's brand new. You go from your ovaries into what? Goes into the uterus, okay? Then you have the lining of your uterus, okay? There's 3 different parts. What are the 3 different parts?
Endometrium and the
Parametrium.
parametrium.
So, let's start on the outside and work our way in. Parametrium, and then you have your myometrium, and then you have the endometrium, which is the most superficial on the inside. Okay? Okay, every lady knows this in general because the endometrium is the layer that you pretty much shed every cycle, and then you regrow it because you are awesome. Okay? You might not feel awesome about it, but you can do that, and no one else can. That is a lady alone kind of thing. You also can carry a child. You are the only one that can do it. There's no male out there that can.
Not according
or
to my
would.
son.
Just saying. Let me just throw it out there. Greg, would you carry a kid? Absolutely not. Okay? So we do not have the will. That's just not, it's not in our nature. Okay, so the 3 parts are very important. In lecture, we are going to go through the entire cycle. Okay? Now, you guys know, and I know that this is probably not taught very well, but there is a window of opportunity for, becoming pregnant. Okay?
Mm-hmm.
Huh? Okay. How many days do you figure it is?
Isn't it 7?
7?
It is about 4 days-ish. However, sperm can survive, what is it? Huh?
6 or...
I thought it was shorter than that. I thought it was about 3 to 5 days maximum, because the vagina is not a... Oh, it's not a friendly place. It is a hostile environment for sperm and most bacteria. Okay, only very few bacteria can live there. It is a very hostile environment. It does not have a pH that allows things to just hang out, which you guys want, because I'm telling you right now, you do not want things growing in your vagina.
Sorry. It sounded really funny.
It's not funny if you ever came across somebody with a chlamydial infection.
Ooh.
It's not a laughing matter.
No,
Okay?
yes.
Okay?
It happens.
It does happen. I wish it wouldn't. Okay? But it's one of those things that is not pleasant. So you,
This is
in
what-
general, favor the fact that it is antimicrobial, right? But the process of it being antimicrobial also means that sperm is not going to hang out there very long either. Okay? So if you have 3 to 5 days-ish, and this is, on a case-by-case basis a little different, but this is averages, plus you have 4 days, that opens it up a little bit. So before that 4 days, it's about 9 days of your cycle that you are fertile, and the rest of the time frame, not so much. So I always wonder how people get pregnant by mistake. I always wonder about that. However, I found out a couple of years ago that some ladies have very, very variable cycles. Okay? And so it makes it very difficult, right? However, most ladies that I know can time their cycle down to 6-hour time frame. And I'm like, how in the world do you know that? Oh yeah,
Oh, yeah.
my wife knows exactly when she is going to start.
When I feel a pain, that's when I know.
No, no, she knows from the time that she had her last one to the next one. She's on a schedule. She's very regimented. Okay, there's a lot of people like that, and then there's folks that take, what is it, Depo-Vera, that never have a cycle. I always worry about that one because it is a natural process to regrow your endometrium.
But I feel better.
Huh?
I feel better since I took the shot, though.
Oh, I don't have doubts about feeling better. I just wonder if it's healthy.
Worth it. Yeah.
But when you're
Get
suffering,
osteoporosis, no,
suffering
it's not
from
worth it.
endometriosis,
Okay,
that's a
that
benefit.
is a separate issue. Okay, if you are taking it because you have an issue,
Yeah.
okay,
Then that's different.
then it's different. It's the people that take it
Oh, I
because they
know.
don't want to remember
Crazy. I don't understand why people
to
do
take
that.
a
It is so
pill.
painful.
Yeah, it's not healthy like that. Yeah.
It doesn't seem rational, but that's just, I don't like to get into people's thought process, but I mean, I can remember to take a blood pressure pill every day. I mean, my wife threw away her what is birth control.
Oh.
It was on accident. She threw
Oh.
away a box that was in there. She's not already planning on Madison's sister. Not yet, anyway.
I was gonna say already. Yay.
No, she's not planning on. But the thing was, she threw it away, and so she had to go back to the doctor and say, "I threw it away." And the doctor said, "Oh, come on." But no one goes for extra birth control anyway. But whatever.
It's free.
Huh? It's free.
No, it's not.
Not in my world.
Mine got it. He's
I pay
nice.
for it.
I think because I got osteoporosis, I think that's why.
Okay. So you guys are with me so far. You regrow your endometrium. It's pretty much sloughed off every cycle, and that's not favorable. But this is also why you ladies need to keep your iron content up, because you lose a lot of erythrocytes, right? So you need to replenish your stock.
So the menstruation cycle is actually the wall sloughing off, not the.
Yes.
Mhm.
Unless you have endometriosis and you're just sloughing off it.
Yeah. Endometriosis means that they lose more than just the endometrium. They start losing the myometrium, which is really not healthy, and it's
And it could attach itself to organs and stuff.
right.
And it's painful.
Okay, so that is the only real reason why I think that it's reasonable to do the depot shot. Just because you don't want to have a period is not a good enough reason.
Or an IUD. Sorry.
Scar tissue.
No, you can get
No,
it
no,
from
no.
surgery.
Yeah. A lot of people can get that for various reasons. Hormones can do it too. A lot of people that.
It's not scar tissue?
Oh.
No, they just say it looks like scar tissue. It's not scar tissue though. It creates a spider-like web-looking thing. Yeah. Sorry.
No, that's fine. Okay, but understanding of what's going on to me in this class is key. Okay, all right. So going from the uterus, okay, there is just one opening. You guys know what that's called. Okay, well, the cervix is one opening for it. What's that canal called? It is the cervical canal. Okay, so there's two openings to the cervical canal. They are called os.
Os.
You have an internal and an external os. It's OS. You guys have never heard of that?
No.
No.
Internal and external os going into the cervical canal. Okay? Okay, this is really one of those things that is key. Okay, because in general, most of the time it is inaccessible to sperm. This is why you cannot get pregnant unless you have a certain window of opportunity, mainly because it is closed for business. Okay? So the external os will not allow anything to pass through. Okay? Alright. Then you get around the cervical canal, and you have your internal os and your external os. You have this general area here. You guys know what this is called? Okay, so within the vagina, around the internal os, or around the external os. Well, that is your cervix, but what is pretty much the depression around the cervix? Talking about the fornix on either side.
What is it?
It's called a fornix. Okay,
Fornix.
so the cervix itself is a round projection, right, into the vagina. It is a round projection, right? You guys looking at the picture, it is not flat, it is round. The cervix actually projects into the vagina itself, right? Okay, so on either side of that projection, you have fornixes, right? These are called your lateral fornix.
Where is it?
Okay.
On the model?
Right here. You see how it's got
Oh, okay.
like an edge?
Yeah.
Because the cervix itself is round.
Mm-hmm.
Okay, so within this, you have a fornix on either side, and then you get into the vagina itself. Okay? Okay, the vagina, this is generally one of those portions that is fairly bacteria-free. Okay, you have a few bacteria that hang out in there, but not very many. With staph, saprophyticus can be there, and hopefully you won't have Proteus there, because if you do, that's a problem, but it can be.
What is that?
Proteus vulgaris. It's a bacteria. Huh? No. Yeast would be, usually it's a Candida infection. No, it is.
I just watched a whole video about this
Candida.
today. An hour long, my cousin sent me, I swear. I was going to
Okay,
ask
that is what causes yeast infections. And it's usually your normal flora, your normal bacteria that occupies that space that keeps your fungal infections from, or keeps the fungus from super infecting. Okay? So it's usually when you take a long bout of antibiotics is where you clear out your natural flora and you allow the fungus to super infect. And they do. And then you end up with, I don't know, it can have a range of symptoms from being a little itchy to very irritated. I've actually seen dermatitis caused by a yeast infection, which is...
Oh, the term with the lady.
Ooh.
Okay, so, you guys with me for that? All right. Now, in general, for the most part, that is most of the internal organs. Now, we have to go over a couple of these. I don't have a great model for that, but that is, in general, if we look at this one here, the external things that you can find when we're talking about female. This is going to be fun. When I say fun, I mean absolutely not fun at all. Okay? You're going to get to what we call the vestibule. Okay? And hopefully okay? So, in general, the vestibule is the entire external opening. Okay, you guys are with me for this? Okay? So the vestibule is this general area here. Okay? Now, when we talk about this vestibule, you have your, I think this is the labia majora is visible, and the labia minora is directly, let's say deep to the labia majora. You guys with me for that? Okay, this entire area, okay, is your vestibule. Okay, you also have to know the clitoris. Okay, that's important. Okay, when we get to that, that is extremely similar to the glans penis itself. Okay, during stimulation, it becomes erect. Okay. This is most of the external genitalia I'm going to get to is mainly, you know, very superficial. I mean, the vestibule itself is interesting, but this is in general just an opening for internal, you know, internal reproductive organs. For the most part, I would like for you guys to know and be able to recognize the clitoris, the labia majora, labia minora. Okay, you also need to know the vaginal opening and the uterus. You need to know your fornix, your cervix, with the internal and external os on that cervical canal going into the uterus itself. You have to know the 3 different layers of lining of your uterus: parametrium, myometrium, and endometrium. You got to know that. You also should know the ovaries, the fallopian tubes, the fimbriae. I would like for you to know the suspensory ligaments that hold the ovaries in place. Okay? You guys can see the ligaments here that are holding it in place. Okay? And if you know most of that, you're going to be in really good shape. Now, there's one other thing. A lot of these things are interesting, but I usually try to get a couple of stories into most of this. Okay, you guys have heard of the hymen before, right? Mm-hmm. Okay, this is at the opening to the vagina itself, the external opening. Okay, in general, they used to test whether ladies were virgins or not by rupture of the hymen. Okay, but with the advent of, you know, most vaginal exams now and tampons and everything that's going on, that they can't do that anymore anyway, and, you know, whatever. Why would we have a test for virginity anyway?
Because it doesn't show in this.
It can't show the.
It says it's ruptured. It's in the top.
It says it's a ruptured hymen already.
Oh, gotcha.
Okay, so in general, they don't.
People that are, like, they're not supposed to get women exam.
Huh?
Like, if they are, how do you know? Yeah, how can they not test anymore? They're not supposed to do it for, like, teenagers.
No, it's by law now, like when you turn 21, you have to do it. So, if you have motion.
Yeah, that's really
They do it.
Yeah.
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 That's what they're doing now.
They're doing those exams anyway, and if you have
with your insurance. And
yeah,
stuff,
if
they're
you have
making you do it.
any kind of issue anyway, they're going to
No,
do a
yeah.
test anyway.
Yeah.
Mm-hmm. Depending, yeah.
Like a lot of insurances now want, or like every girl once they turn 21 to have to get it done.
Yeah.
Yeah, well, it's getting away. Okay, it's one of those things you have to get that test done in order to get birth control anyway.
Yeah.
Period. Some ladies are ended up having severe mood swings and uncontrolled. Well, not just weight gain, but they have emotional issues and severe mood swings, and they find out that at some point birth control seems to moderate that. I
depends,
honestly
yeah.
don't have a judgment call for this. This is what people make their own decisions on proper health care. I just have never felt that these kind of things ought to be dictated. You ought to be free to make your own decisions.
Well, now you have a little girl, so now you're.
I have a little girl, and my decisions will be dictated by my wife, like any good husband would say in that situation, because I will not stir up that hornet's nest.
Good man.
Okay. Okay, so those are the parts of the reproductive system that I really wanted to get into. We are going to dissect sheep testes right now. This is going to be interesting, and then we are going to be good for today. Okay, so